Yeah, no kidding, no kidding. Thanks for helping. Yeah, right. Thank you so much.
Ladies and gentlemen, we are in session now. It's 1 o'clock. First thing we're going to do is have the roll call, please. Mrs. Campisi. Present.
Present.
Present. Present. Paul Foster, 4 Miles Davidson.
Present. Present.
Present. Present. Present.
And Mrs. Perkins, would you please lead us in our pledge?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Couple of notes here. We're going to be delayed on the main agenda for a while. Mrs. Mahina is here, and we don't want to waste her time. Let her get back to what she really supposed to be doing for our county on a daily basis. And so the other item I need to mention to you is that item 12 will be scratched on potential discussion of a contract. So with that, I would entertain a motion to recess for the executive session and return after it's completed.
Motion to recess.
Thank you. Is there a second?
Second.
Mrs. Campisi, call the roll, please. Yes.
Yes.
Yes. Yes. Yeah.
Yes. Yes. Yes.
Yes.
We are in recess. Thank you.
Oh. I probably should have plugged that back in.
Executive session. To return to the agenda.
So moved.
Thank you. Is there a second? Mrs. Campisi, call the roll, please. Yes.
Yes.
Yeah. Yes. Yes.
Yes. Yes. Yes.
Next is the public participation. I have one. Mr. Washington.
Thank you, my wonderful, illustrious horseshoe guest. My goodness, don't start a time till I get ready. Straightforward and brutal is definitely my intent today.
Okay.
Allow me to ask the ethical question, if you will. When are you kind folks going to stop promoting profit over detainees who are locked up in the Oklahoma County Detention Center that I so rightfully dub as the House of Horror? You have repeatedly overlooked the incessant horrible stories that are being shared on a daily basis by the men and women who are confined there. And yet to me, it appears to me that it's your way of doing your part in the continuation of the human trafficking that is perpetrated by the United States of America. I have determined, by the way, looking at this issue closer, I have determined that all of these vicious, unconstitutional acts of violence, discrimination, racism, and exploitation is allowed to be perpetrated and gone on for the purpose of financial incentives for you to continue. By allowing the unconstitutional practices to go on, you have paved the way for the argument of needing more money to fight the horrible things like creating undue stress, mental anguish, suicidal tendencies, mental health issues, and problems with emotional instability. That's right, you heard me. Moving on. You have waived intentionally the Constitution and human rights of these detainees, again in favor of profit. You see these men and women as no more than human household goods. And I'm here to tell you that we're not tolerating it any further. We're not going to allow you to continue to overlook the injustices that's going on. People staying in the waiting area cells 2 and 3 days without mats, without being fed appropriately, and not even given a sanitary condition in which relieve themselves. This is not a joke, my friend. You're getting money to treat these people in a human type of way. Yes, then there may be for a crime and some are actually or not guilty, but that doesn't mean prejudge them by treating them in the way you do in medieval times. And yet you tell me we are a moralistic society. Where is it? Where have I missed out on it? I'll tell you today I'm not going for it. And now I'm encouraging those people in there. What they need to do is file a class action lawsuit. If y'all listening to me under the sound of my voice on YouTube or wherever you are, I will help you without question, free of charge, because this thing has to change. This is not some pleasurable moment where you can say, I sit back, go drink your coffee, play with the children, go to a restaurant and say, oh, what's our next assignment to deprive these people of their rights? Thank you, sir, and I will be
Time's
back. I
up,
appreciate
Mr.
for this
Washington.
time.
Thank you very much.
Hasta la vista, I will be back.
Item number 1 is a discussion and approval of minutes of our October 7th meeting. Motion to approve. Is there a second?
Second.
Thank you very much. Mrs. Campisi, call the roll. Yes.
Yes.
Yes. Yes. Yes. Yes.
Yes.
Yes.
Yes.
Item 2 is a discussion and hopefully acceptance of our scheduled session for 2025, the fiscal year. No, the calendar year. I apologize. There was a mistake in the 2 dates on the original posted agenda. You have in front of you the corrected dates. The 2 dates that were misrepresented, unfortunately, happened to be June 16th and July 14th. Those have been corrected to the proper times. I would entertain a motion for acceptance of these dates for the next calendar year, and we can go forward.
Motion to approve the slate of dates.
Thank you. Is there a second? Thank you, Mrs. Campisi. Yes.
Yes.
Yes. Yes. Yes. Yes.
Yes.
Yes.
All right. Item number 3, Mrs. Garner, your report, please.
Afternoon.
Afternoon.
All right, we have a lot to cover, and this time it's not all me, so I'm just going to jump right into it. Standard updates, our academy, some of the things that we're doing with our programs, what we're doing to help develop our staff, and then some of our general statistics. So currently we're at 336 full-time employees. That includes 53 current full-time medical employees that we've recently absorbed, standing up our own in-house medical. We do have 284 current full-time detention employees. We have 17 that are currently in the academy that are officers and 4 civilians. If you look at the number of officers that we have compared to what we had, last month we had 159. This month we have 172. Those are people that are detention certified that can work directly with our population. As compared to this time last year, it was at 119. So we have vastly increased the amount of security staff that we have in the facility at any given time. I would point out that the graphs, they do not speak to the medical employees. We haven't had time to segment that out yet, but that'll be on the next report. We did have a graduation. It was 2 weeks ago. We had 15 people that graduated the academy. They're in the on-the-job training section right now, and it was the first class that we had who received the in-house CIT training that was facilitated by our new counselor for our staff. And then we did start the Academy 2404. It began on November 4th. We started with 17 cadets, 4 civilians, and then we have 6 contractors that are in that training. Their graduation is December 20th, and I just want to point out that we do have a new assistant training director, Mike Duncan. He comes from many years' experience with DOC. He's been an assistant jail administrator for another county. A wealth of knowledge and that lived experience, and it's helped a lot as far as the training goes for our staff and helping them understand exactly what they're getting themselves into before they start working independently on their own.
And this week they did start our custody and control portion. I just want to highlight that we are in the process of opening up a wellness room for our staff. This is one of the old training rooms upstairs. It's going to have a lot of options for our staff to just kind of relax and unwind. It's designed to get them out of the jail environment. It'll be crucial to have it available when we have a critical incident happen, to just get them out of that environment and help them de-stress. There's a lot of research that was done on this and has been done on it. We came back with this idea from the American Correctional Association conference, and this was one of the keys to retention, is just being able to provide this to your detention staff. And along with that, we do have like I mentioned before, a new counselor. Her name is Mary McLean, and she has some very strict guidelines as to what we expect to see as far as her key performance indicators, and she's already hit the ground running on those and meeting with our staff. Once we get the wellness room completely opened, I think we're going to have a lot of movement towards utilizing that in a variety of ways.
Excuse me, as a suggestion, when she gets her sea legs and you're up and operational, it'd be nice if she came and joined us sometime for a brief update from her perspective.
I'm sure she would be happy to.
Thank you.
Yes. Many people have already been briefed on this, but just as a reminder, on October 12th, we did have significant flooding issues that caused a lot of technological operational challenges, but we are working through it. Right now, they are in the process of replacing the sump pumps downstairs. So these issues are not, this all happened, it was a perfect storm, but this is an ongoing issue with this facility. We have pipes that are corroding, they're rusting, and eventually they're gonna have to be replaced in various areas. I know there's a place over our criminal investigations division right now that has corroded pipes, and we're going to have to do something to replace that. Of course, anytime you do that, you have to shut down the water just to make those repairs. So just something that's coming down the pipeline. I don't have a time frame on that because there's several different areas that are going to have to be repaired, but it is something that we're going to have to address as long as we're in this facility. Current programs, we still have all of the same programs that we have. We did add a arts program with the Lynn Institute. This is, don't quote me on it, I think it's about their 4th week of doing it, and the feedback that we've had so far has been really great. We would like to continue to add on to that program, and they're going to do well, this is actually old information from the team. We did do the gift bag thing back in September. Back to our intake screening, something that we started tracking approximately 78 days ago. We had over almost 5,000 intakes during that period. 1,909 of them screened positive for something on that screening. And as a reminder, that can be for mental health, substance abuse, whether they are homeless, if they're a veteran, opioid use disorder. There's a whole host of things that we're screening for. It is self-reporting data. And as mentioned in the slide at the bottom, there 2 of those items are validated screening tools. So we had about 39% of the population that was booked in since August 20th, screen positive. There's some of the numbers there that you can see. And then if you go to this next one, you can see, and this is updated as of the 6th of November. We had 132 people that claimed that they were veterans, and 966 people over that 78-day period have claimed that they are homeless. Of those, 448 screened positive for some sort of mental health condition. 124 had alcohol use disorder, or they indicated that they had an issue with alcohol. 243 indicated that they had some type of dependency on opioids. 140 came in under the influence of some substance. And then if you look at the mental health, for the brief jail mental health screen, 527 people indicated that they are, they screened positive for the mental health. And then some of those numbers, the 920 under the influence is a typo. That's going to be 92.
Go ahead.
Director, I just want to make sure I understand the assessment correctly. This is strictly a self-report with no data validation to any type of treatment history or anything. Is that correct?
That's correct. It's something that's asked at intake.
Okay. So it hasn't been data matched.
It has not. But we use this information in order to help make referrals, and it's indicative of something going on with that person. Obviously, if we can confirm that they have had mental health treatment in the past, we're going to get them on those medications as quickly as possible. Same thing with any other.
Is this data used at classification time as well?
It's not being used at classification time. I mean, if they indicate that they're mentally ill or they have some sort of mental health,
Self-identified then.
it's self-identified, right? It is used, limited use right now, but it will be used more broadly to just help get us our programs. What do we need here? What are we seeing here the most? And then there's a statute that Oklahoma passed that requires us to give Narcan to anybody that comes in that has opioid use disorder. And so this will help us more readily identify those people rather than just being based on charges alone, because sometimes people don't come in on substance abuse related charges. They could come in for a property crime, but they also indicate that they have a substance use disorder that they're trying to fund through their criminal activity.
Go ahead, sir.
Realizing how difficult data collection is and how hard data matching is. You and I have been having this conversation since
Yes.
my appointment. I would be very interested in one of these screening windows to see if there was a way we could do a data match to engage the individuals and contrast what they are reporting versus treatment history in the community. Because at the end of the day, it's that cycle of detainment,
Mm-hmm.
returning to the community, not receiving appropriate engagement and care, and then cycling back into our facility. And we have a really interesting opportunity to drill down and have a pilot cohort to understand how successfully, as a broad community, people are being engaged in treatment modalities.
Okay. Any more questions about the data on this slide? Okay. This is just a quick update from our information technology department. We are currently looking at our jail management system. This is a really large expense, so it's just something that we're exploring. But we are looking at a couple of different options to see if there's something that assists us with being more data-driven because of the difficulty we are having with the current jail management system and just entering and getting data from it and making sure that it's accurate. We are looking at migrating some services to the cloud. This is something that will help in the event that we do have a network outage. We will still be able to have access to our jail management system. And the other one that they are wanting to migrate is Core EMR, and that's the electronic health record. Medical data transfer is completed. I know that IT has been working with medical and trying to ensure that all of the forms that trigger tasks, medical tasks, are updated. They had to go in and manually create each one. And so that's just kind of a laborious thing that they've been working on. And then they're working on a Homeland Security grant just to apply for some various technology that we can use.
May I ask if there is a time of the jail tracker contract expiration?
There
Tied with the county?
is, I believe it'll be, don't get me to quoting, I'll look into it.
Okay,
Pretty sure it's on the FY.
sorry.
I'm pretty sure it's on the FY. The other thing is it used to be tied to the old phone contract. So I don't know what that contract looks like now or what it would look like going forward.
The phone company's gone.
Yes.
Yeah.
Yeah.
Okay.
So that's why I'm saying I don't know what it's going to look like.
Well,
And it's extremely premature for us to be, I mean, we're just exploring it, just
Understand.
seeing what's up there. I mean, we did just renew to try to get some of the upgrades this fiscal year in order to move to a digital process. But as far as being user-friendly and being able to collect the data that we need, we're finding it's extremely difficult. And I know that there's more services out there that are a little bit more
We do need to move eventually, sooner rather than later, to a new system.
Correct.
Because we're behind the power curve.
We are. We are, absolutely. We did start doing in-house pest control. This is just kind of a graph. I've had the guys start tracking what they're doing and what the complaints are. One of the things that we've done is we've enabled a ticket system that our residents can access on their own instead of relying on an officer to pass along the information. And so our pest control applicator will go in and look at those, and it kind of structures his day every day that he comes in, so he knows what areas he needs to focus on. We are starting to see a reduction in a number of complaints, and it's actually really encouraging that we have somebody there that can take care of things in-house. Here's our average daily head count, including all of the historical data. For the month of October this year, the average number of people booked in was 56.91. The average daily population, if you go off of the morning count, is 1,518. The average length of stay was 7 days, a little bit over 7.5 days. If you look at the average daily population over the past years, last year it was just slightly lower, which was 1,511. 2022, 1,587. 2021 was 1,683. If you look at the arrest by agency, Oklahoma City continues to be our top contender with 62.3% of the arrests booked in. The total number of bookings for October 2024 was 1,881. And that includes 1,435 males and 446 females. We continue to refine this slide as I find things that I think are really interesting. This is about recidivism. It not only speaks to the number of people that are currently incarcerated and what that looks like as far as maybe their criminal history, but for the month of October, 66.62% of the males that were booked into custody have at least one previous charge or history of criminal charges, and 58.37% of the females that were booked in also have one previous charge, so they're recidivists. For a total of 64.69% of people that were booked in October have a criminal history of some sort. If you look at the current population that we have, the current female population, 78, almost 79% of them have a criminal history. They're recidivists. And then for the current male population, almost 80% of them have previous charges at some point in their life.
Yes, ma'am.
I know as of last week, we had 6 persons. Do you know what the number is today?
Pregnant?
Pregnant.
The last time I checked, it was also 6.
6. Okay, thank you.
I am going to call up our medical team towards the end of my presentation to address some of the things that they've been doing. So they would be able to give you any information that you need.
Okay, thank you.
The top 10 charges, and these are people that are currently in custody. For the first time ever, we're seeing first-degree murder as one of our top 10 charges of people that are in custody, and that's 5% of our population. Possession of CDS continues to be one of the top numbers, and then firearm by felon. And there's some of the other statistics if you have questions about them, or if you want me to change up what I'm presenting, please feel free to let me know. I'm happy to attempt to get you the data that you want.
Can you better define holds?
Holds can be anything from immigrations and customs enforcement. It can be for another state. It can be for another county. It could also be for a municipality. So somebody may have state charges and city charges, but their state charges, they're taking care of those. And the hold is just so once the state charges are disposed of, then the city would take over. And it's the same thing with any other jurisdiction. If it's a county or another state, obviously states, you have to go through a different process to get them released, but once we dispose of their charges here in this county, then they'll go on to wherever they're supposed to go.
Is there a way to speed up that process?
It depends for which one. For counties?
Well, basically everybody. How about getting all the people that we're holding?
So States typically
that
will
belong to
require,
somebody else out of our system.
right. I don't know what our out-of-state holds look like, but it's typically not as high as some of the others. There's nothing we can really do to speed that up because it requires a governor's warrant or a waiver. What I would say is that when it comes to the other counties in our own state, we already give them a number, a day that they have to come pick up their people or arrange for it, and they're usually pretty good about that.
How about ICE? We're up to 85, 86 on ICE detainers.
Correct.
Is there a way to give them a call and
So
speed up their process?
ICE is actually there. It's just a matter of getting those charges disposed of.
Okay.
So even though they have a hold from immigrations, they maybe have state charges that they still don't have a disposition on.
Thank you.
You're welcome.
Real quick,
Oh.
Ms. Gardner, on the ICE holds, do you recall what the reimbursement rate is on that?
I'm sorry?
Do you recall what the reimbursement rate is on the ICE holds?
No, I do not.
Okay.
Assuming they pay.
We're missing part of the slide, but I think if you have the printout, you can see that our current population, as of November 5th, was 1,488. And if you look back a year ago, it was 1,081 or 381. We do have 144 people that are sentenced to DOC, 173 individuals who are over the age of 50. And then we have 24 that are currently awaiting transport to Oklahoma Forensic Center in Bonita. Of those, 87, they've been waiting an average of 87 days. And the average days that they've been in custody is 201 as of today. And the longest is 253 days. That's almost a year. 3 are awaiting a second trip to Oklahoma Forensic Center, and 1 is awaiting a 4th trip. Now I'm going to call up Dr. Winchester and our Healthcare Services Administrator so they can give you an update on the medical. I felt it was probably best coming from them so they can answer any questions with a level of expertise that I do not possess.
Okay.
Before you get started, I want to thank both of you for stepping up during this treacherous time. We're not completely there yet, but hopefully you're going to bring us some good news today. And I know it's been a 24/7 battle over the past month, but from my perspective, you and your staff are doing wonderful jobs for the citizens of this county, and you're taking care of the men and women who are in your direct custody. So thank you.
Thank you. I consider it an honorable task to try to tackle the challenges of this. So I'm Dr. Mark Winchester. This is Donna Hanson. She is the Health Services Administrator, and might add a very good one.
Could you speak more directly into
Oh,
the
yeah,
mic,
I'm sorry.
please? That would help.
And a good administrator. I've worked for both, so she's excellent. For just being able to identify who we are, I've christened us the Oklahoma County Detention Center Resident Health Services Division. So it seemed straightforward and appropriate. About myself, I've had 30 years of practice experience and broad experience. I've been in emergency medicine, private practice, hospitalizations, ICU, community health, innovation of healthcare delivery systems for Medicare and Medicaid, and then here. So in the everyday work that we do there, I didn't expect, but I do call upon all of those factions of my experience and training to get through a day because the need there is very broad. It comes up daily. Hanson has had 30 years of nursing and administration with a big emphasis on corrections and audits, and comes from a prestigious job, I consider, of doing audits for corrections in California and now here, and I believe in Texas. Our resident health services include about 45 nursing staff and MedPass personnel. On-site services are OBGYN that we do prenatal work with Dr. Hamid. He is part-time there. Dental, we have contracts with X-ray, ultrasound, laboratory. We have 2 mental health providers, nurse practitioners, and we have 3 counselors, myself, 1 full-time physician, 1 full-time nurse practitioner that takes care of medical care routine reassessments, physicals, and we both tackle both chronic care and acute care because with 2 of us, that's necessary. No, and I'm not, are you moving now? So I was told that you guys would be interested in hearing my perspective on what was going on. I've been working at OCDC for about 3.5 years. I came on board as an employee for Turnkey, and Dr. William Cooper hired me and gave me the outline of what the work would be there, and he was mostly truthful with it. And he said, just try it. I wasn't sure that that's what I wanted to do. I had a couple of other things that were offered, but this was different. And it certainly seemed to be a challenge that would keep it interesting. Goals at this point, and in contrasting them to what was present when we first got there, would like to improve the medication administration consistency to where it is consistent, safe, less medical errors, more qualified people to do the job, getting medications to a large number of people with a limited staff in the right amount of time frame, correct medicines, and timely with changes in orders. And so that's a big job. And so we would like to examine and improve on that, and we have begun that. We'd like to restructure and improve psychiatric care delivery. Dr. Hernandez has gratefully, I am grateful for having her come on board to help with this. We have been reorganizing medical records and software with CORE. For obvious reasons, it is the basic information tool that we use. And bringing it across from Turnkey has been a challenge. And I think that Turnkey kind of took the same approach that they've been using with us for a while, and that they really have not been on day-to-day function with what we do for some months. And I'm not privy to why or why the support that we were lacking was a fact on a day-to-day basis. We have carried forward with the things that we do, and with Ms. Hanson, we have, I think, been successful in continuing at least as well as what we were given. And at this point, with the empowerment to be able to make improvements where we see that improvements need to be done. I think we are making progress in identifying areas that I think are the highest priority. With the advent of AI, I've instituted, we're starting that with charting to be able to do not only a full progress note, but a transcript recorded of each patient's interview and visit within the office, both myself and the nurse practitioner. That's not completely available in the clinic areas yet, but we're looking at it. It seems to be accurate. Have to do the proofreading to make sure, but it seems to more than cover all of the medical information that was talked about during the visit. Sometimes it speculates on things that could be done additionally, and we cut those out if that wasn't really addressed. But it's better to have information that we can delete than it is to have omissions. So far, I'm pleased with that. Having quick access to complete records, it should decrease our liability, improves the future of healthcare needs for each resident. I think with those advantages, to be able to bring our clinical practice up to something that you would not mind bringing your family members to or coming in for medical care is the goal. Certainly, using community standards and individualizing each patient's healthcare, just like I was in private practice. That's what we intend to do and have done thus far. At first, I thought there were limitations, and I think they were based on the culture at the time I first came in 3.5, 4 years ago. And so at this point, I've discarded most of those as part of that culture, and just we go with referring and achieving medical care goals for each patient, just like they were private patients in high dollar clinics and name a community. Yeah. So would like to continue to work with the fentanyl pandemic that we are seeing. We have made progress, and that the overall vigilance that the jail staff through Ms. Garner has provided has improved significantly since she has been present. And we have statistics on resuscitations that we could publish, because all the components of emergency medicine are there on premises. When the checks that are being done on each of our patients is done, they can identify people that are having difficulty that is like indicative of an overdose as early as could be possible, between the officers being trained in first responders skills, with our team that goes down that really has all the elements of an ambulance. And so we send down a nurse, a paramedic, EMT, and the staff that we have to be able to respond and provide more advanced care. And then we bring them to the clinic, an ambulance takes them to the hospital, and all those components happen in a chain of events that helps, I won't say help, I'm saying that it is essential to the survival of the patient. I was a paramedic early, and the survival rate of not in the hospital, in the field, cardiac arrests and resuscitations was probably in the single digits when I was a paramedic. Those percentages were awful and were discouraging, but we saw that in that chain of events that has to happen, there was always a weak link. And if there's only one, the resuscitation effort fails. And so we have gone from 47 in-house deaths down to, so far for this calendar year, 7. I can't name the number of resuscitations that we've done. It's in the hundreds. The last I counted was somewhere around 400. And so you can calculate the number of resuscitations that we're actually having to do full resuscitations with CPR and respirations and Narcan. And compared to the people that are surviving that, that's a really big deal. It takes a lot of communications and cooperation to be able to achieve that. Would like to expand on that with being able to add a true MAT program to what we're doing. Would like to also, at some point, organize if people that are enrolling in MAT or that we enroll them within the jail can be followed after they leave the jail to be able to offer outpatient treatment, monitoring, advocacy, a contract that we can say that they're having clean screens and they're living up to their end of the contract. I think we can present a positive reward for people that are coming out of the program that would incentivize them to enroll in it. So these are ideas so far, and I think they can be done. I've seen examples of them being done, and I see the elements that we could use to be able to bring that about. And the above goals certainly should help recidivism and the rate of it and decrease that. We would like to plagiarize other programs by visiting and doing communications with other facilities that may have elements that we want that we don't have yet. Yeah, so that's what I had written. I would like to do Donna now to talk about the ways that she's been bringing that about, like with evaluations for very fragile patients that stand a risk of dying in-house, and an aggressive program for being able to counteract that.
Hi. So I meet weekly with providers, whether it's the APRN or Dr. Winchester. I also meet with the psychiatry team to see who has the potential and likelihood to decline while they're in custody. From there, I write them a medical OR and submit it to Major Logan, and he processes it through the court. I just really want to take an opportunity to thank Ms. Gardner and her administrative staff for their unwavering support in this transition. It has been exceptionally difficult, and we're knocking it out of the park. So thank you.
Pretty good. So at this point, certainly I'd open it up for any questions that I can answer.
Thank you, Dr. Winchester. Any questions, comments? Hearing none,
Thank
you're
you.
free to go.
Thank you, sir.
Thank you.
Mr. Chairman,
Yes.
we ask Ms. Director Gardner some questions.
Oh, sure, sure. Mr. Johnson?
I just want to know where we're at on getting Forsyth's group back in, even on a limited basis.
So to be honest, we've been focused so much on medical. I haven't had an opportunity to revisit that yet.
I'd just like to, each meeting just have an update where we're at. Sure. Sure. I appreciate it.
Okay. Any other questions?
If not, we'll move on to item 4, snail's pace here. Mr. Sherman? Oh, sorry, we need to accept her report. That would be Mrs. Garner's report. Is there a motion?
So moved.
Thank you. Is there a second?
Second.
Mrs. Campisi, call the roll. I always forget that. Yes.
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 Thank you. Now, Mr. Sherman.
Good afternoon.
Good afternoon. We all should have a printout in front of you, I hope.
Okay, so going through the last month's information as far as revenue goes, the total income in October was $2,825,726, which gave us an unfavorable variance to the budget of $58,831. Most of our revenue continues to come from the general fund from Oklahoma County. The other sources of income for the month were Oklahoma Department of Corrections revenue was $134,973 for September boarding, which was above the budget by $24,973. We're noticing a little bit of an uptick in county jail backup from DOC. Telephone revenue was $91,109, which was below budget by $28,891. But that is due to the trust's decision to lower those rates for the residents. There was no commissary revenue because the payment was not received until November, so that will be reported on next month's statement. And we are still, as far as municipalities, the boarding revenue for the month was $732. Of course, the Oklahoma City contract is still pending, and we still do not have contracts with Hera, OKC, of course, and War Acres is the only other municipality. As far as our expenses for October were $2,848,343, which gave us a favorable variance of the budget of $218,451. Salaries, wages, and benefits totaled $1,601,102 for the month, and which was above budget by $66,241,000 due to medical staffing. Our resident on-site medical care of $193,493 was for turnkey comprehensive medical services, which was prorated due to the termination of the contract on October the 9th. Our resident off-site medical care, which was $40,420 and below budget by $29,580. Utility bill for electricity was $33,000. I'm sorry, I've hit the wrong buttons on some of these. I apologize. The utility bill for electricity was $33,528 and was below budget by $6,472. Professional services legal fees were $27,987. Professional services and other fees were $252,285, which was for painters who are working on through Express Personnel on the pods repainting, janitorial services, professional consultations, and our VIMED staffing, which was $214,009. Telecommunication services were $19,850. $11,926 will be reimbursed from the county for the ARPA networking project. Telecommunication equipment for the ARPA networking project was $35,721, and it will be reimbursed from the county. And medical supplies was $35,356. We needed to replace our AEDs within the facility. They were all about to go out of date, so we replaced all of them. So the summary for October 2024, jail operations produced a net loss for the month of $51,520. Cash on hand after paying the October invoices and October payroll and benefits is estimated to be $2.9 million. So right here, this is our budget comparison to actuals. So our FY 24-25 budget was $321,203. And of course, we went at $559,346. On our anticipated billing, we've currently found that $7,711.97 and $11,779.42. And that represents transportation costs for both Department of Corrections and mental health services residents that were in our care. We have not been billing them for some reason, so we are correcting that. We have billed mental health a total of $806,390.72. We continue to bill them. That was for last FY and up to date to this FY, and we are billing them on a monthly basis. We are currently looking at our offsite medical and have requested information from our Heritage Health Solutions, which handles our offsite medical. And What we're trying to do is figure out how much we're spending on off-site medical, especially for DOC and mental health. And the problem we're running into is that the information we have in Jail Tracker is sometimes showing that they were in a medical facility for 2 days, but the medical facility is showing they were in there for 4 days. So we're trying to figure out, and then going back and trying to get that billing from the facility such as SSM or OU Medical has been difficult, but we're trying to find those connections to figure out where there's a disconnect. And I think part of it is in the Jail Tracker system, and maybe some of our staff maybe not entering the information correctly, but we're trying to figure out exactly what that problem is.
Would you give me the names of the two facilities you're talking with and the person you're trying to talk to about those things?
We've been talking with Heritage Health Solutions because they handle our offsite medical, and they've been dealing with both.
I'd like to call the institutions myself.
Okay, sir, I will
See if we
get
can
that.
speed this process up. I mean, this is asinine to have to wait on a third party to make something happen when we're behind. Speaking of being behind, are we going back and making sure we're billing corrections in the mental health department properly? I mean, have we missed any other?
No, those were the
Invoices?
those were the areas that we were missing, and so
What months does that represent?
it would represent
Just the past month?
no, from the first of the FY up until now.
Okay. Yes, ma'am. Go ahead.
I have a question, Mr. Chairman.
Yes.
Chris, I see it here underneath anticipated billing. You've gone back for an FY and year-to-date FY for Oklahoma mental health. And I've asked now for 3 months in a row to see the anticipated billing for Oklahoma City's use of our facility. What is the status of that?
I'm sorry, I think we should have that number. I'm sorry you don't have it. I will get that to you.
I've asked, this is the third month this trustee has asked for it to be disclosed here.
Okay, I will get that number. We'll get it on next month's agenda.
No, send it to all the trustees, please. Let's don't wait till next month.
Okay.
Yes, I mean, I'd like to reiterate and emphasize the importance of this. When Oklahoma City is using 62% of our capacity and our bookings for any given month, it is absurd that we have a significant backlog with them.
So is on this next slide is our NCIC resident communications revenue. As you can see, on a monthly basis, we've kind of slowly gone down a little bit each month as after the change in billing. You can see our October income statement. I don't know if any of the members have any questions about any of the items for October.
Just to clarify, Chris, back on
Yes.
the Oklahoma City issue, this does contain expenses that are incurred on behalf of Oklahoma City, but have not yet been either invoiced or paid by
Absolutely.
Oklahoma City.
Yes. And if you see on the expenses on the insurance, the workers' compensation, that was for 2 months. That's the reason that number was much higher. Does anybody have any questions about any of the information on the income statement?
You through with your report?
Well, there's one more, which is what you were asking
Right.
about, which is this is a comparison, and it was not titled, and it should have been, but this is a comparison from our FY24 budget to our FY20 budget year to date, just so that you all could have a look at that, and if you have any questions about any of that information, we can revisit it.
So at this point, we're ahead of the power curve.
Correct.
Over last year, in essence. Any questions?
I do have one more
Mr.
question.
Yes, ma'am.
I believe that a couple of months ago, we asked to start seeing a list of contracts that were coming up for expiration. I don't know if the most appropriate place is to include it in the financial report or in the CEO's presentation, but can we get that included next time, please?
I'll
Consider
get
it a
with Brandy,
priority.
and we have a list of when our contracts are coming due, so I'll get that updated, and then I'll get with Brandy, and we'll get that to everybody.
That would be very appreciated.
And the
If you
three
could email
local
that, that'd be great.
communities that we haven't received contracts from, have they been notified? Time's running? Okay, thank you. Any other questions for Mr. Sherman? Anything else you want to add to this particular report?
Not at this time, sir.
Okay, need a motion to accept Mr. Sherman's report.
Motion to approve.
Is there a second, please? Thank you. Mrs. Campese, call the roll, please. Yes.
Yes.
Yes. Yes.
Yes.
Yes.
Abstains?
All right, thank you for your votes. Going to item 5. Mr. Sherman, that's you as well.
Yes, so it's discussion and possible action to approve change endorsement to workers' compensation insurance policy to provide the required coverage for new medical staff employees.
I'm sorry, I misspoke. That's item 6. Yeah,
No, I believe that is 5.
no.
5 is invoices and claims.
Invoices and claims, which we need to have another
Oh,
motion on that.
Motion to approve claim.
Thank you. Is there a second? Thank you. Please call the roll. Yes?
Yes.
Yes. Yes.
Yes.
Yes.
Yes.
Now, item 6, which is additional endorsement of the workers' compensation or insurance policy for the folks that we brought on board for the medical staff, just so everybody's covered. And this will date back to when we took over on the 9th of October, correct?
The 10th.
The 10th?
Yes, sir.
Fair enough.
Motion to approve.
Thank you.
Second.
Thank you. Mrs. Campese, call the roll. Yes.
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 Yes. Yes.
Yes.
Yes.
Thank you very much. Item 7,
So
mental
this is
health.
discussion and possible action to approve memorandum of understanding with the Oklahoma Department of Mental Health Services and Substance Abuse to provide opioid overdose training and overdose reversal kits.
Motion to approve.
Thank you. Mrs. Campese, call the roll. Yes?
Yes.
Yes.
Yes. Yes.
Yes.
Now you have also, Mr. Sherman, item 8, which is a fingerprinting equipment from OSBI via a grant.
Yes, sir. So this is for discussion and possible action to approve memorandum of understanding with the Oklahoma State Bureau of Investigation for live scan fingerprinting equipment.
Yeah, this just says real time, so motion to approve.
Thank you. Is there a second? Thank you very much. Mrs. Campese, call the roll.
You broke it?
This is just an indoctrination effort on our part. So, yes.
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 Yes. Yes.
Yes.
Yes.
Yes. Thank you very much for your votes. Item 9, Mr. Sherman, we're talking about pharmacy, the status of our pharmacy services potential with the county.
So since we now have 30 days, we've compiled or compiling that information. We're going to get with John Wilkerson here at the county to go over our usage, at least our current usage right now, to see if we can get some sort of benefit from going through the county system instead of using Diamond Pharmaceuticals as who we solely use right now.
Is that a month-to-month contract?
It is currently, yes.
Currently. They're okay with that, and we're
Mhm.
okay. Okay. Any questions? I guess there is no action to be taken other than to accept your report on this. Is there a motion to accept his report?
Motion.
I'm sorry?
Motion.
Thank you.
Second.
Thank you. Miss, yes?
Yes.
Yes.
Yeah, we do.
Yes.
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 All right, item 10, Mr. Sherman. Jail competency, which I thought Mrs. Garner was going to do.
I think there's a component to this with the billing situation, which is maybe why it's put on there for him. But essentially, I would like to send a letter to the Department of Mental Health regarding the jail-based competency services that we have and the MOU that we do or do not have. I don't know if it's. Really don't know what I'm supposed to say.
Well,
during
there's probably not.
I feel like I've
let's just
covered
say
a lot
because
of
it's tied to our executive session number, item 15. So
right.
unless you want to say something else other than that, or
I would like to bring up.
Dr. Hernandez.
Yes, I'd like to bring up Dr. Hernandez, who can more expertly address some of the issues that we have with jail-based competency.
Welcome.
Dr. Hernandez.
You've been with us now, what, a couple of months? And
About 6 weeks.
6 weeks, and has that given you enough time to give you a snapshot of where we are as a facility?
Absolutely. I think I can echo there's a lot of progress being made. There's also a lot of work to do. And so I think you're getting a great team together to do that work. It's very hard, and you have some good-hearted people here.
Thank you.
So in relation to the jail-based competency, I'll keep it very brief. There are a number of transcripts in your own county that outline the failures of the alleged jail-based competency program, in which the sole provider has stated that he's learned to do this job via Google, that he's had less than 12 hours of training, that he does most of his services at the most through Beanhole, yelling through, sections in the doors, things like that. And I think there's a number of transcripts that echo that. We don't need to reinvent those statements. They are from the staff themselves. We also had a recent interim study in which your chief public defender outlined some of the same things that were seen in the transcripts related to intensity being about 10 days of service per session, that they are sessions that are happening via yelling through beanholes, which is unacceptable. It doesn't meet any standard of care related to forensic competency restoration services. The individual who's providing those services himself has outlined his lack of training. He is a licensed marriage and family therapist with 12 hours of training virtually, and has learned how to do the rest by searching Google. And so I think that puts us in a position where we have no alternative but to say this is not okay, not acceptable for our residents in our jail, and that our individuals deserve quality care in a timely manner that does not violate their rights.
Any questions for Dr. Hernandez?
Thank you for coming on board.
Mr. Chairman, one quick
Yes,
question.
ma'am.
So you stated that the Department of Mental Health's assigned practitioner is a licensed marriage and family therapist. What is the standard for competency-based for jail-based competency treatment? What credentialing should they have?
So typically you see a varying pattern across multiple states, but at the minimum, they should be a licensed mental health provider, which an LMH he is. However, it also states that there is a robust training protocol that must be implemented before somebody can go out and go forth. The other thing that is lacking is there's no treatment team. There's one provider, and by their own admission and transcripts, there's not been any other forensic person, doctor, psychiatrist, rendering any direct services.
Follow-up question, Mr. Chairman.
Please.
Dr. Hernandez, we also recently heard that from out of the mouths of the director of the Department of Mental Health, that most competency includes medically assisted treatment. Are they providing any direction on medically assisted competency restoration in the jail?
So as it stands right now, under our current MOU, it states that there should be some medical oversight, that there should be a medication review committee established, that there should be something occurring. The sole psychiatrist provided own testimony stating that he has never seen anybody at our jail, has never stepped foot in our jail, and the LMHP assigned to our jail has said that he's actually never met him in person.
That's unacceptable
Correct.
and despicable.
So again, these are just the words of transcripts that you can look up.
And we're operating the largest mental health facility in the state of Oklahoma.
Absolutely. So
What is the Department of Mental Health doing in their daily jobs?
I can't answer that, sir. I would just say the interim study that we just held outlined that, yes, jails have become the de facto mental health systems not only in this state, but every state, and that Oklahoma County, by and large, is the largest. Jails were not equipped to be therapeutic environments. They never were. They never should be. but we are doing the best we can with the environment we have, with the resources that we have. If we have individuals who are in jail who are languishing, and by all accounts, from any data that you look at, including the data that was just presented today, we have individuals who are serving longer sentences waiting for restoration than if they would have just been convicted or taken a plea. That's unacceptable.
Do you happen to know the size of the mental health department budget annually? Ballpark?
According to records, it's $500 million annually.
$500 million. And they can't show up to do their job?
I can't answer that, sir. I don't work for
I'm
them.
sorry, that's a rhetorical question. Enough is enough.
Yeah. Individuals deserve quality care. They deserve timely care so that they can make rational decisions about their own lives and the things that they are able to agree to. We shouldn't have seriously mentally ill individuals in jail in the first place, but here we are.
And if I remember properly, we had an individual who spent over 1,300 days waiting for restitution. 1,300 days. And they've got $100 or $500 billion budget. No, a $500 million budget. Okay, any other questions? I'm sorry? No, behind the curve. Thank you for your report.
Thank you.
Appreciate it greatly. No action to be taken on this particular item. We'll get to item number 15.
Hey, Mr. Chairman, I think there's a couple of motions probably to be made on this item, if you would allow.
I thought that was tied to our executive session 15.
Okay, if that's the way you want to do it, we can do it.
Well, if you want to propose
go ahead.
them now, no, doesn't matter to me. Let's get with it. Well, we're on our way. Sherman, you're back up again. Sorry. Number 11. No, you're talking about the mental health RFP that we're putting out, and soon to follow, that comes today, gives it to Jeff. Dr. Hernandez may want to talk about that also. And then we'll
I
follow
believe that's more
on.
apropos.
Okay. You're not a mental health person?
Well, so we are putting together an RFP for a quality and qualified mental health provider. And so in doing that, we're looking for expertise with correctional populations, looking specifically at bifurcating medical and mental health so that they're a collaborative team. Typically what you have is you have great medical providers, but they're not so great at mental health as an expertise, and then vice versa. And this has a way to also hold checks and balances and keep people accountable for quality care, metrics, things like that. We're also looking for recidivism reduction. We're looking at diversion opportunities, how we can really classify our seriously mentally ill individuals and figure out where the off-ramps are, because jails, again, are not a suitable place for them. And they could be better served in the community and or other placements that are secure, that are intentioned for mental health needs. So the other things that we're looking for is collaborative care, continuity of care, access for data, being able to look at our screening protocol. We spent Friday going through how somebody goes through the process and looking at how we can improve, how we can constantly improve given the circumstances and the environment that we currently have, and then also how our training can really enhance the way that our staff respond to mental health crisis, but also prevent mental health crisis. And so we don't want to just react. We want a system that's going to be able to predict and prevent where we can. So that RFP is going to be a robust one, looking for expertise in a very particular place, because not all mental health providers understand corrections, and not all correctional systems understand mental health. And so we really are looking for that unicorn, but they do exist, and we want to be able to partner with somebody who's going to bring quality to the residents that we serve, but also be a great partner to our systems that are already in place, which is our embedded medical care and our corrections staff.
So, Doctor, notwithstanding the conversation we just had about competency, I mean, it will remain consistent that there will be people with behavioral disorders, whether it be mental illness, addiction, or co-occurring, that we will have an obligation to serve.
Correct.
Is it plausible that as part of this RFP, we could consider some sort of data analytics or third-party evaluation to make sure that the handoff from individuals who are detained back to the community is successful and complete?
Absolutely. Any robust RFP should be looking at data analytics when it comes to quality of metric, quality of service. And then we want to look at that revolving door. We just saw the data shown that a high percentage of our individuals currently in custody are coming through that revolving door. And what do we know about systems is that we typically, and this is just an example, we're a place where we slap the Band-Aid on the bleed rather than constantly doing the work to look for the source of the bleed and really fix it. And that's what we're looking for, is to figure out what that data actually says.
Yeah. Mr. Chairman, this is a question for you, just to confirm. I believe our trust gave authority to issue the RFP to staff at a prior meeting. So today is a procedural update as we walk towards what will hit the streets. Is that correct?
That's
Yes.
correct.
Okay.
That's correct. No vote is needed on this. They have authority to move forward now. Yes, sir.
I just want to say I'm thoroughly impressed with you and everything that you have shared. And I wouldn't want to banter back and forth with you. Not at
Thank you.
all.
Thank you. If there's nothing further, I thank you all for the opportunity to serve.
One more. Estimated time before our RFP will be able to be on the streets. Do you have a good estimate of that?
I know it's
to
with
this
legal
point?
right now.
All we're waiting for is the clearance from legal to get it up there. So I know that we were going to follow up last week. I'm not sure where we ended with that. We'll follow up again this week.
The clearance with whom?
Legal
Oh,
counsel?
legal.
Yep.
She's talking about you, sir. Yeah, okay. Thank you both. Any other questions, comments? All right.
One thing, if I may, that I will
Yes.
also say is we saw a lot about co-occurring conditions. One of the other things that we discovered walking through is we have other co-occurring conditions of disability, and we are factoring those things in as well. Better training for the staff to be able to communicate effectively with individuals with various disability types.
I have a question on that. Is that going to require movement of those individuals to the proper floor?
I believe that's already occurring.
That is happening. Okay, good.
Thank
Sooner
you.
the better. Thank you. Thank you very much. All right. Item 12 was dispensed with. That contract is not ready. Item 13 is Oklahoma County Criminal Justice Authority Citizens Advisory Board. Yes, ma'am, you're here instead of Mr. Speaker.
I am.
You're much better
I hope
looking
that
than
that's
he is, let me tell
acceptable.
you.
Well,
Something decent to look at.
It's been a little bit since I've been here.
Is that a sexist comment?
But it's always a pleasure to be amongst you. We have a number of new trust members, so glad to see them. As a reminder for those that are new, I am Erin Engelkey. I'm the vice chair of the Citizens Advisory Board. Because I am last on the agenda, I have been informed that I need to be prompt and quick to get you all out of here. So I'm going to do my very best to do that. But I do have just 3 things that I wanted to update you all on. The first being the report coming out of the recent focus groups that we've conducted within the detention center with both the males and the females. So on October the 22nd, Criminal Justice Authority Board Member James Johnson, as well as our esteemed friend Chris Steele, went into the detention center to conduct these focus group discussions, and this is what they learned from the females to start. First of all, the women indicated that the food service is better. Breakfast options could improve, but other meals are better than in the past. They stated they are allowed time out of their cell for 3 hours on Mondays, Tuesdays, Wednesdays, Thursdays, and Fridays. Seems like an improvement. The women stated options in commissary are limited and expensive. They identified noodles and beans as the primary or only options. They revealed access, quality, and variety of electronic tablets are better. They said being able to watch movies on their tablets is a viable and much needed mental health break. The women pointed out that staff engage in routine cell checks frequently and according to schedule. They said that their pods are cleaner except for the showers and reported mold in the shower area. They stated that their overall access to health services can be limited and lacking, but understand improvement in the delivery and quality of healthcare is underway. They stated that the bed bug situation is much better, but bed bugs are an issue from time to time. They stated that they have limited access to properly fitting undergarments and delays in receiving blankets. They also lamented about not being allowed to wash clothing in a timely manner. They pointed out that their interactions with staff are, quote, good and positive. They strongly prefer their mail be sent directly to the facility rather than to an out-of-state entity to scan and send their their mail electronically. Finally, the women affirm the overall cleanliness of the facility, positive atmosphere, and functional microwaves as tangible improvements. Moving on to the men had to say that the food service is better, but as we have continually heard, the diet is heavy on carbohydrates. They said breakfast options could be better. They indicated the bed bug situation is better than in the past and beginning to deteriorate. The men stated the shower area is in need of deep cleaning. They said communication with family members can be challenging and difficult. The men requested a desire for additional programming, especially in relation to reentry services, employment assistance, and connection to community support. The men revealed older individuals are technologically challenged and need additional assistance accessing the kiosk. They indicated a need for improvement in access to and quality of medical care. The men said interactions with staff is mostly positive. Some staff are good and some are not. One individual requested additional access to basic hygiene products like fingernail clippers. They expressed disappointment over group sanctions because of inappropriate behavior of a few. The men lost their opportunity to use the microwave on their pod because someone attempted to light tightly rolled tissue paper known as wicks in the microwave. I have no other information regarding that. But that is a summary of the recent focus group discussions. We will be conducting those focus groups again next week. I will be participating in next week's groups and sincerely look forward to that. Okay, a couple of other really quick things, and then I promise I'll wrap this up. The next Citizens Advisory, as I just mentioned, focus group is next Tuesday, November 19th at 1:30. We would love for any members of the trust to participate with us. Obviously, we had a recent trust member with us. So if you are interested in participating, please let myself or Chris Steele know. Finally, the next care package distribution for those who reside inside the detention center will occur on Saturday, December the 7th at 9 a.m. Anyone interested in helping with the care pack distribution can absolutely participate. They just have to submit their name, birthday, and driver's license number to Chris Steele by November 15th. So it has to be submitted just within the next few days. So I'm assuming everybody has his email address. If not, I'm happy to provide that after. So any questions that I may answer?
Don't have a question.
Any questions?
Just want to make a comment.
Yeah.
Sure. Mr. Johnson.
Every time I go out there, it's improving.
Mhm.
And one of the things they said about the food is they want more. So I think that's a compliment.
Sure.
They
Yeah.
want more. And with regard to the mail, maybe we need to educate them, explain why that happens because of drugs being in, I guess, under
Right.
stamps and things. And they went, oh, so maybe just educate them on why that happens that way and so forth. But overall, it just keeps improving. So, hands up to Director Brandon and your staff. They're doing an outstanding job. So, but
I
anyway.
absolutely agree. I mean, I've been a part of the Citizens Advisory Board for, I think I've lost track of the number of years now. And I will say that there are dramatic improvements. And so definite kudos go to Brandy and her team.
Any other questions? Thank you for your report.
Thank you.
Take care. I apologize for any consternation I may have caused earlier, either online or in this room. So I'm going to skip by item number 14 right now. You both want to hit me, don't you? Figured as much. I'll skip 14. I'll come back to it at the end. So we had several items in executive session. We only have 3 action items. We start with item number 28, which deals with the mental health department. And as discussed, the most important part is the letter that was passed out and Brandy wants to send. I would entertain a motion on adopting that letter and sending it. Oh, I'm sorry.
So moved.
Thank you. Is there a second?
Second.
Mrs. Campisi, call the roll. Yes.
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 Thank you very much.
Mr. Chairman, on that same item, I'd like to make a motion to terminate the MOU between the Department of Mental Health and Oklahoma County, just to clear up any misconceptions that there may or may not be one in existence.
Understand? Thank you.
Second.
Is there a second? Thank you very much. Mrs. Campisi, call the roll. Yes.
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 Item 16, I'm sorry, not 16. It is 29. We have too many pages in front of us. 29 concerns the pending litigation, ongoing litigation between Oklahoma Criminal Justice Authority and the state of Oklahoma. Is that right? And I think that is deals with the mental health department, not the mental health, the Department of Health, excuse me. Doesn't say that in the, so that was tied to our earlier discussion. Is there a motion to proceed?
Mr. Chairman, I'd like to make a motion to appeal against the state as discussed.
Second.
Thank you very much. Mrs. Campisi, call the roll. Any comments? Did you have a comment?
No,
No. Oh, you're,
the verbal second
you're
was
put-
different than the screen, so.
yes.
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 The balance of those items, the rest through number 40, require no action at this point. So I'll go back to 14 and announce our next meeting on December 9th, 2024, to be held in accordance with the Oklahoma Open Meetings Act. Other than that, any other comments for the good of the order today? Or a motion to adjourn?
Move to adjourn.
Thank you. Is there a second?
Second.
Thank you, Mrs. Campisi.
Hey, James.
Yeah.
Motion.
She did. Yeah. Yes.
Yes.
Yep. Yes.
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 Great. We are adjourned.